Hello everyone and welcome to the Safety and Compliance Center. This is Bilal Khan and here I will simplify NEBOSH IGC course for you. I'm very confident that by the end of this session you will have much better understanding of the topic if you will interact with the exercises given between the session. In this video we are going to talk about something very important, especially for anyone working in environments where the chemicals and the harmful materials are present. We will be discussing the forms of hazardous substances, how they are classified, and the health risk they present to the workers. Let's start by looking at the different forms of hazardous substance that can take place. Hazardous substances can appear in different physical forms, including the solid, dust, fumes, gases, mist, vapors, and liquids, and even the fibers. Each of these forms can behave differently in the environment, and more importantly, they can enter the human body in different ways. For example, the dust and fibers might be inhaled, liquids could be absorbed through the skins, and the gases or vapors can both inhaled and can spread quickly in the air. So the physical form of the substance play a major role in how dangerous it is and how it affects our health. Now, let's move on to the classification of hazardous substances. One important category includes the biological agents. These are the living organisms or substances produced by them that can cause harm to our health. They are also usually grouped into fungi. For example, exposure to certain types of mold can lead to diseases like farmers' lungs, a serious condition affecting the lungs. The bacteria, these are responsible for the illnesses like Legionnaires disease or leptospirosis, which can be caught through a contaminated water or contact with the infected animals. Viruses, examples include the HIV and the hepatitis B, which can spread through blood and other bodily fluids. Each of these can be a serious health risk, especially in certain workplaces like the healthcare facilities, the agriculture facilities, and the waste management facilities. The risk generally falls into two main categories like the acute and the chronic effects. The acute effects happen quickly. They usually result from high levels of exposure over a shorter period of time. For example, breathing in a high concentration of chlorine gas can cause immediate breathing problems or irritation. The chronic effects develop slowly or over time. These are caused by lower levels of exposure but over a longer period. A good example is repeated exposure to asbestos, which can lead to serious lungs disease years later. Some substances can cause both the acute and chronic effects. For example, the organic solvents or the alcohol can have immediate effects like the dizziness or headache, but long-term exposure can also damage an organ like the liver. So it is important to understand not just what the substance is, but also how often and how much you are exposed to it. There are three main categories: the physicochemical effects. These are related to the physical and the chemical properties of a substance. Example include the substances that are highly flammable, explosive, or oxidizing. The health effects: these substances can directly harm our health. For example, the chemicals that are toxic and cause cancer or damage organs. The environmental effects, these are the substances that can harm the environment, such as those that are toxic to the aquatic life. To make sure these hazards are clearly identified, there is a regulation in place, the European regulation, or also known as the CLP regulation, which stand for classification, labeling, and packaging. This regulation ensures that substance and mixtures are properly labeled using standard symbol and warnings so that the workers and the consumer can recognize it, the risk, and handle them safely. Some specific health hazard that hazardous substance can cause, these are commonly identified on chemical labels and safety data sheets. The acute toxicity, these substances are extremely dangerous in small amounts. Just a small dose can cause serious illness or even a death if inhaled, swallowed, or absorbed through the skin. The skin corrosion or irritation, these can either destroy a living skin tissue like corrosive or cause the inflammation like redness and itching. Serious eye damage or eye irritation, similar to skin effects, these substances can either permanently damage eye tissue or cause a painful irritation and watering. The respiratory or sensitization. These substances can lead to the long-term allergic reactions. For example, they may cause asthma when inhaled or allergic dermatitis when they come into contact with the skin. It is important to recognize these hazards, use the correct personal protective equipments like gloves, goggles, or proper ventilation when handling such substances. The germ cell mutagenicity, these substances can cause the genetic mutations that may be passed on the future generations. In other words, they can damage the DNA in a way that affects the offspring. The carcinogenicity, these are the substances that can cause cancer. Long-term or repeated exposure increase the risk, even if symptoms don't show up right away. The reproductive toxicity, these chemicals can affect the fertility or human harm an unborn child during the pregnancy. They may lead to the miscarriage, developmental issues, or the infertility. The specific target organ toxicity, these substances can damage specific organs in the body, such as the liver, kidney, or the nervous system, either after one time or repeated exposure. The aspiration hazards, these are the substances that can be dangerous if inhaled into the lungs, especially liquids. They can cause the serious lung damage and even death sometimes without the immediate symptoms. Thank you very much for watching this video from the Safety and Compliance Center. If you have any question regarding this session, please drop your questions in the comment section below. I would love to answer that. This is your channel. Like it, subscribe it for more safety content. Stay safe, stay blessed, and goodbye.